Hello, I'm Dr. Victoria Hill, a consultant clinical psychologist, and I've been asked by LAM Action to look at how living with LAM can impact on your mental health. Over the course of 2 talks, we will firstly look at the emotional reaction to a LAM diagnosis and the issues that arise from it. Then, in talk 2, we'll take a look at the longer term effects of LAM and suggest some coping strategies that may help, whether you are newly diagnosed or have lived with LAM for many years. As a starting point, we asked members of the LAM community in the UK to send in their experiences of LAM. So let's hear from those women in their own voices.
When I initially had problems, I had a biopsy taken during surgery and it came back negative for LAM. But 5 years later, after the problems hadn't resolved, I received the diagnosis of LAM. I was gutted.
I decided within a couple of days of being given a rather bleak prognosis that I somehow needed to turn it into a positive, because I worried that if I didn't, that LAM would just consume my thoughts.
My main concern was the impact having the disease may have on my daughter. Would I be around long enough for her to make her way in the world?
I went through about a 6-month period of feeling very suicidal and wondering what the point of it all was. I withdrew from everyone and pushed everyone away.
A diagnosis of LAM can be life-changing and, as we've heard, traumatic. So receiving a diagnosis of LAM is sometimes like receiving a bereavement. It can be quite devastating and shocking to start with. And a lot of people will go into denial about it. This isn't happening to me, this can't be happening to me. I'm going to completely ignore this because it is too devastating. It's a way for the brain to be coping. It's a way for us to cope with such difficult news. It's very common for people with LAM to feel angry. This is not happening to me. This is unfair. And we've heard a lot about feeling very distressed about what impact it might have on you and your lifestyle, but also on your family. What do I tell my family about this disease and what it means for the future? Will I be around, as we've heard, for my family in the future? That can drive people to feel quite anxious, very low in mood, certainly perhaps for the first few weeks, first months even, of receiving a diagnosis of LAM. But we've also heard that there's a little bit of resilience in there. We heard from someone that they were going to start to see this in a positive way. They're going to accept this diagnosis and we're going to start to learn how to manage it. So even though you might want to shut the world out, because that's a very normal human reaction, it's really trying hard not to do that, to keep your trusted family and friends close and keep your social supports, because in the future you will need them. And in the here and now, they are going to be really important after you've been diagnosed with LAM. Your loved ones are likely to want to reach out and support you, even though you might think they don't understand what you've been through or what you're going through now. It's about how to help them to help you. It's really tempting to read too much, particularly when you've just been diagnosed, in order to find out all the information you can about your diagnosis. But some of that information could be quite difficult to absorb. You may not be quite ready to absorb it. And also we know that people's experience of LAM can be very individual, very different. Not everything you read is what is going to happen.
Looking at all the info on the internet led me to believe there wasn't much hope for LAM patients, and I had at best 10 years to live.
The life you thought you were leading versus the one now. Living with the fear of another lung collapse. How do you make sure it doesn't stop you doing things?
When faced with a life-changing diagnosis such as LAM and the high degrees of uncertainty that can come with it, you know you probably need to find some flexibility going forward in your lifestyle and how you manage your disease. This is not going to be an easy thing, and particularly not at the beginning. You may grieve the loss of your former self before you had that diagnosis of LAM, but part of acceptance of the diagnosis will be finding that flexibility so that you can manage your symptoms ongoing. Everyone's journey to the diagnosis will be different, so everyone's reactions will also be very individual. We do have a tendency to have different types of coping styles as individuals, and this may impact on how you do react to your diagnosis. So we can have what I call a sort of appraisal-focused coping style. You're altering the way you think about your diagnosis of LAM and what it means for you now and in the future. Then we have what I call the task-focused or orientated copers. You're going to do things, you're actively going to try and problem solve. Perhaps a little bit difficult with something like LAM, but you're focusing on the things you can control, such as seeking the right information, managing symptoms, trying healthy living. And then there's sort of the emotion-orientated coping. This might be emotional release, talking to people, getting it out there. It might be distraction. You're going to distract yourself totally. Or you might use mindfulness, staying in the here and now, noticing what's going on around you rather than thinking all the time and having an emotional reaction to your LAM. And meditation, very similar to mindfulness. You're just really trying to take yourself out of your LAM diagnosis and thinking about other things, meditating. You could actually have all of these coping mechanisms at play at the same time. They're not exclusive.
I definitely struggled with panic attacks when going out, especially when travelling.
We're going to talk about the facets of anxiety. Anxiety, when it gets really quite severe, can be really quite life-crippling and can get out of control and make people feel that they can't keep a grip on it. It can be manifested physically. Anxiety can actually cause people to feel quite breathless. We also talk about people just feeling really lightheaded, heart racing, all sorts of physical, horrible manifestations of anxiety that make people feel quite unwell. There's also what I call the cognitive or thinking aspects of anxiety, the constant worry about maybe the future or the here and now, your family, not being able to sleep either, concentration difficulties because your mind is elsewhere, constantly worrying. You might fear the future. You might really catastrophize as well, and that can make people feel really, really panicky. Thoughts can come quite intrusively as well. You might be doing something and a thought might just pop into your head. It feels kind of uncontrollable. And then, because you're really anxious, it will just stop perhaps other things like enjoying life, enjoying activities. You may not go out, you may not socialise. You might struggle to maintain relationships. The person doesn't understand why you're so anxious. You can't really tell them how you're feeling. You might avoid places that make you feel more anxious, and that's a particular difficulty, I think, when you have a diagnosis such as LAM. So we've talked about anxiety emotionally, worrying, and feelings that you get when you're anxious, but also we tend to start doing things differently when we're really anxious. We might start doing things like compulsive checking of things. So, for example, if you feel particularly out of breath, you might start to compulsively want to check your oxygen levels. Although really, really difficult, what psychologists will try to do to encourage people who feel that they need that constant reassurance is to start to take steps to break that cycle of compulsive checking. One of the first things that helps us to try and manage anxiety and worry is actually to understand our anxiety. As I've said before, sometimes anxiety or anxious thoughts can just pop into our head. It feels like we don't have any control over it. As a psychologist, what I would do with anybody I was trying to help is to help them think about whether their thought processes, whether they are feeling anxious or any other emotion, whether their thoughts are rational and helpful in the situation. We'd ask people to write their thoughts down and start to question and analyse them. We might get people to say, think, am I jumping to the worst conclusion here? What's the evidence that this worry that I have and this anxious thought is actually going to come true? Am I actually exaggerating or catastrophizing, which is what's making me feel so much worse? And what would I say to a friend or loved one to make them feel better, or to think of the situation in a different way? Sometimes worries can be so overwhelming and all-consuming, they can take up our entire lives. They can continue on throughout the day and perhaps at night. And one of the other techniques that I usually use when I'm trying to help people who are very, very anxious is to actually get people to make a time for worry. Now that may seem a bit strange, that I would actually say to someone, I want you to sit down for half an hour and actually worry. Seems counterintuitive, doesn't it? But actually what you're doing is you are containing your worry. So if you really, really need to feel that you need to process those worries and those thoughts, try and contain it within a shorter amount of time in the day, so you have the rest of the day for your own. So you are really trying to hone down those worries, so it makes the rest of the day not so overwhelming. It's what we call worry time. The other things that we've talked about is shifting your focus. We've talked about mindfulness. That technique comes based from Buddhism. It's about shifting your focus to the here and now. It's about thinking about what's going on around you, those small aspects, the positive things, the trees, the flowers, the smells in the air, the sounds that you hear. All of those things, if you focus very hard on those, will take you away from some of those anxious thoughts that you're thinking. It will give you some relief. You might try relaxation. You might try yoga. You might try a more active sort of sport or something very explosive, depending on what you are able to do. Sometimes it actually helps to just take a very problem-solving approach when we're feeling stressed and anxious. What can we do differently or change in our lives to actually make things feel a bit better? It can be really pragmatic things, changing the shop we go to, or changing who we see in the day, someone perhaps who you feel more confident with. It can be really small pragmatic things that might just help take that edge off the anxiety.
I don't like to be seen as ill. I feel frustrated about the limitations my breathlessness sometimes imposes on me.
There never seems to be a reason for why one day I'm coping and the next I'm not.
So the other thing that a lot of our community have said is that after the diagnosis of LAM, that their mood drops significantly, that there will be quite some dark days of low mood. And we're going to talk a little bit about how we manage that mood. Again, a little bit like anxiety, one of the things that we try to think about is understanding the thoughts that are associated with that low mood. And yes, it may be difficult, but to try and write down those thoughts. What are those thoughts? When are you having them? And when we got those thoughts down on paper, to try and think about analysing them, a little bit like the anxiety thoughts, analysing, am I jumping to the worst conclusions? What's the evidence that this thought is really true? How helpful is it for me right now to be having these thoughts at all? And is there a different way that I can look at this? I'm not in any way saying that this is an easy thing to do, especially when you've had such a difficult diagnosis. And it takes practice to analyse and really think things through. And also try to say, even though this is very difficult, what things are still good in my life? What sort of things am I still able to do? And also, I guess it's about being kind to yourself. Setting yourself achievable tasks, praising and giving yourself credit for reaching those goals. Those goals may need to be a little bit adjusted given your diagnosis of LAM, but it's about not berating yourself for not achieving a very big goal, but actually giving yourself praise for the smaller goals. Try not to do everything at once. Take breaks. Be kind to yourself. So we know that actually if you feel quite low in mood, it can also affect our sleep. Sometimes it's a struggle to get to sleep, or that you have early waking. You wake up in the middle of the night or early in the morning worried or feeling quite depressed or low. The problem is that sleep is a really important thing. It obviously rests our brain and it helps us cope with on day-to-day things as well as perhaps our low mood. So getting good sleep will help our mood. Sometimes that's difficult. You're thinking, well, how am I meant to do that? My sleep is affected. I've tried things. Well, we would talk about things that might be actually quite simple to try to help you, which is what we call sleep hygiene. Just really straightforward things about not drinking caffeine at night, not drinking alcohol at night, because actually alcohol usually gives you poor quality sleep. It might make you go to sleep quick, but it usually then the quality of your sleep is poor. You don't go into a deep sleep, which will then help you. We tend to watch iPads a little too much, maybe a little bit too much tablet work, maybe too much television at night, and that actually disrupts our sleep, so we've got to be really careful about that. Make bed for sleep and make television in the lounge. You do that in the lounge, you go to bed for sleep. I think sometimes what happens is we mix things up. We tend to watch television or our tablet in bed, and then it's not conducive to actually saying, well, actually, I'm having a break here. This is the place I need to fall asleep. This is the routine I need to take to get some good sleep. And I'm going to leave the tablet or the television away from the bedroom. So it's not uncommon for any of us to feel low in mood. And those moods can last for, a few days, a few hours. It's not an abnormal thing to feel at all. A general low mood can just feel sadness. You might feel anxious if you're feeling low in mood as well, and sometimes a little bit panicky about something. You might be worried, you might be a little bit tired as well, and you might just feel just not good in yourself, in your self-esteem. And all those things are normal. We all feel those. It's about being human. But how does that then manifest differently when you are actually depressed? I guess what we'd say is that low mood tends to alter after a few days, maybe a week or so. But actually, if that low mood doesn't go away after a couple of weeks or so, you may start to think that actually you're suffering from depression. And those symptoms of depression could be mild, moderate, or actually even quite severe. Any mood that lasts over 2 weeks, but also accompanied with other things like not getting enjoyment from anything that you're doing or what you used to enjoy. Feeling kind of hopeless, not really being able to see any light at the end of the tunnel. Feeling tired, really lacking in energy, just not being able to get up and do anything. Just not being able to concentrate, not being able to read or watch television. You might completely lose your appetite, or you might actually sort of comfort eat and be eating too much. You might not be able to sleep, as we've talked about, but you might just sleep more than usual, completely shut down. You might be sleeping many, many hours in the day. And you might also have thoughts of harming yourself or suicidal thoughts, which are obviously very concerning and worrying. So if those negative feelings, such as extreme feelings of anxiety or low mood, don't go away, or they feel too much to cope with, or it's actually stopping you just from getting on with your normal life or the life you were leading, you may actually need to make some changes, and you may need to get some extra support. Sometimes, if those symptoms are mild, seeking a sort of trusted friend or family member, seeking their support might be good enough and might just help you out of out of the feelings of depression. You might actually want to contact LAM Action for one-to-one support, or LAM Talk UK, or the LAM line, to talk to peers, to talk to people who understand what you're going through. If things become quite difficult, you may actually need to speak to your GP, and usually you can refer yourself directly to an NHS psychological therapies service called IAPT, and you can do that usually without a referral from a GP. Just go onto your NHS website to do that. So if you're feeling acutely distressed or mentally unwell, maybe you're feeling really quite suicidal or extreme anxiety, you can call NHS 111, who will be able to advise you. Or you may want to call a mental health helpline like the Samaritans, the number being 116 123, or email joe@samaritans.org. So that brings us to the end of the first talk about LAM and mental health during the early stages and just after diagnosis. In the next talk, we're going to look at living with LAM in the longer term. So for the moment, goodbye and take care.